volume of A equals, so that would give you the mass, right? So this would be the mass of X, right? Now this X has moved into this compartment B, right? So because X has moved in there, we are trying to understand what is the mass in here, and through that mass, we know the mass. From that mass, we'll be able to see what is the volume here. So over here, we're going to say concentration in B multiplied by the volume in B. Now in this situation, we do not know what B is, the volume of B. So what we would do is we'll move this over here. So what would happen is we'll say concentration of A multiplied by volume of A divided by concentration of B, that is this guy who has come here, so would be moved from here, is going to be the volume of B. So if you put the values, you would actually know that the volume of B is 2 liters or 10 liters or 100 liters or whatever. So this is the formula which is used to understand the volume of various body compartments. So how do you do is you take a known substance, you inject that, the known quantity of the substance is taken, injected into the body, then you let it stay there and disperse equally, and then you take a sample out, and then based on that sample, if you take the concentration applied to this formula, you get the volume. Now the question is, if I give something, let's say I inject a dye, so I take this and I inject that here. So substance X is here. If that substance X only stays in the vascular system, it does not get out of the vascular system, then if I take a sample from the vascular system, and please remember the sample can only be taken from the vascular system. You cannot take a sample from the interstitial, you cannot take a sample from the intracellular fluid. The sample of the fluid is taken from the vascular system. So we inject it in the vascular system, we're going to take the sample from the vascular system. So the substance has been injected. If this substance only stays in the blood vessels, why would it do that? It depends what type of a substance have you introduced. So for example, let's say you have introduced radioiodinated serum albumin, RISA, radioiodinated serum albumin. So it is the albumin which is tagged with the radioactive iodine. That albumin has been thrown in the blood vessels. Do you think it's going to stay in the blood vessel? Yes. Why? Because the albumin is a protein which is not going to move out. Correct? Now if you take a sample of the blood and you measure the protein in there and then you apply this formula, what that would tell you will be the volume of intravascular compartment. Why is that telling you the volume of intravascular compartment? Because we introduced a substance which only stays in the intravascular compartment. If you had introduced a substance which did not stay in here, then the volume will not be for the intravascular compartment. Okay, let's talk about one more thing. Let's say you introduce something inside the blood vessel which then goes and equilibrates in the interstitium but does not go in the intracellular fluid. So we are talking about another substance now. You introduce that in the blood vessel. From the blood vessel it goes out and it equilibrates with the interstitium, but it does not go in the intracellular fluid. What could be the substance? For example, mannitol. Mannitol would go in here and will not be moving in the intracellular. For example, inulin. Inulin is a substance which, remember, it is found in the roots of a plant. It is not normally present in our body. So when you introduce that in the blood vascular system, you inject that fluid or that substance would then equilibrate in the extracellular fluid. Now if you take the sample and you put the numbers in this formula, what will you get? You will get the volume of ECF. Right? So it depends what type of a substance is used. The formula is the same. Introduction is in the blood vessel, sample taken is from the blood vessel, nothing else. But it depends where that substance can go. Depending upon that, we can understand the volume of various compartments. Right? So now let's say I come to you and I say, hey guys, can you do me a favor and tell me a patient's ICF compartment size or volume? What are you going to do? So I've asked you to figure out what is the interstitial, I said ICF, I meant interstitial. What is the interstitial compartment's volume? Now there is nothing which you can give in the intravascular system which will go in the interstitium and not stay in the intravascular. That's not going to happen. You don't have any substance which will be introduced in the blood vascular system which will then move into the interstitium and then stay in the interstitium and not come back into the vascular system or not equilibrate with the vessels. There's nothing, too bad. So that means you're going to tell me that there is no way to calculate the interstitial fluid volume. That's fair, but here is how you would do it. To understand what is the interstitial fluid volume, you will measure the intravascular volume, which now we know you can measure that. You have the formula. The formula is going to stay the same. It is a substance which is going to be different. So in case of trying to understand the intravascular compartment volume, what are you going to use? You're going to use radioiodinated serum albumin, or you can also use Evans blue. Remember Evans blue from histology? So you can also use Evans blue. Evans blue, when that is introduced in the vascular system, it goes and gets stuck to the current albumin and current proteins. It gets attracted to them and gets stuck onto them. So that means it will not get out of the vascular system. Right? Now you take a sample from the vascular system and you measure that, and what would you get? You would get the volume of the intravascular compartment. Good. Now you got in one piece. Then if you can also understand the volume of this whole compartment, the whole ECF, which you can do by using inulin or mannitol, then you can subtract from the ECF, subtracting the intravascular would leave the interstitial. So that means you have to do two measurements. You have to measure the ECF and you have to measure the intravascular, subtract the intravascular from the ECF and you got the interstitial. So measure ECF. That would be measured by inulin or mannitol. Good. So let's say ECF comes to be 15 liters. Then measure the intravascular. Measure intravascular. What will you use for that? You would use RISA or you would use Evans blue. Evans blue, right? So let's say this comes out to be 4 liters. Now you can figure out what is interstitial fluid. Interstitial fluid is going to be 15 liters minus 4 liter equals 11 liters. That is your interstitial fluid volume. So that is an indirect method of measurement. Alright. So similarly, if you wanted to understand what is the total body water, what you do is you introduce radioactive water. You introduce water which is either deuterium or heavy water, or you introduce tritium or tritium, some people say. What are these things? These are actually H2Os, but deuterium means 2, tritium means 3. What that means is that if you take a hydrogen proton, it would have one proton in it, right? Hydrogen atom. If you have, normally it doesn't have neutrons. So H2O, normal water, is also called like this. Deuterium is called H2O with 2 over here. Tritium is called, or tritium is called H2O with 3 over here. What that means is this. So this should be 0 actually. Normal water or normal hydrogen atom does not have a neutron. You could have 2 neutrons in it and that is called heavy water or deuterium. Or you could have 3 neutrons in it, and that